Hopefully you've been watching Discover Remarkable at the Heart of Medicine about bariatric surgery and the Michigan Bariatric Institute. I'm Lila Lazarus with two wonderful guests with me today, Dr. Jacob Roberts from the Michigan Bariatric Institute and the rock star of our show, Kelly Brighton. How many pounds are you down at this point?
96.
96. It's just incredible. What are you going to do at 100?
Thank you. I have a party with protein, lots of protein, right?
That's it. We want to invite you to get involved in this conversation. We'll be answering all of your questions and more. The number to call, 248-356-0077. The show, of course, is about 3 lives that have been remarkably transformed. And this just in, a 4th life from this show is also about to be transformed. Tell us.
My husband has set his date, and he's going to have the surgery in March.
Which is so incredible. Yeah. And we know that his experience is going to be as magical as yours.
Definitely.
So before we even get into this, let me ask you, Doc, since this show first aired, tell me how what's been happening.
Well, the phone lines at the office have been ringing off the hook. A lot of interest, a lot of patients wanting to come in for that initial consultation to learn more. Our seminars that we do monthly are filling up quicker than they ever have before, so it's been really positive for us and for the program for sure.
And what has been the most important message that you have wanted to get out to people?
That people that suffer from morbid obesity, there is an option for weight loss. Surgery offers them an opportunity to get a tool that can help them take the weight off, change their lifestyle, and hopefully lead longer, healthier lives.
I'm not going to wait another minute because the phone lines are already filling up. So let's get right to the calls. Line 1, you are on with Dr. Roberts and Kelly Brighton. Your question?
Hi. I have tried everything, and I love to eat, so I don't know how can that help me. I can't think of one more thing to try, one more diet.
How common does this, what's your name?
Leona.
Leona, how common does Leona's question sound to you?
I'm sorry, say it again?
Leona, how overweight are you?
I'm about 50 pounds overweight, and most of my life, I just, we're foodies here. We love to eat. But the rest of my family doesn't have that problem.
Well, that totally sounds like me. Growing up, I don't know how far you guys are into the TV segment, but my younger sister is very thin and has been my entire life, and I was always the big sister, and I am definitely a foodie, and I think I still am even now after the surgery. The greatest thing about the surgery is that you still can eat anything almost anything you want, but it's just so much less, and your tastes do change.
How heartbreaking is it to be overweight for you, Leona, having tried everything?
It's, it makes me not want to go out very often, and then I end up, overeating at home. So it affects my life.
Yeah, I think this is a common theme we see with our patients when they come in, as they describe always feeling hungry and never reaching that sense of fullness until they've eaten so much food, then they're completely uncomfortable. And I think is what the surgery offers is what we call satiety, is that sense of fullness, a sense of well-being off of the eating, but we can do it at very small portions. And that's the idea, is that once you have the surgery, you're going to have a tool that's going to make you feel full early, it's going to keep you full longer, and it's going to keep you satisfied. So at the end of the day, the amount of calories you're taking is going to be drastically decreased.
What about 50 pounds overweight? Is that enough? Don't you guys usually go for someone who's 100 pounds?
Yeah, I'm not sure what her height and her weight is, and we'd have to calculate her BMI. She may think she's 50 pounds, and maybe it's more, maybe it's less, but we would really have to...
probably more.
Yeah, we'd have to bring her into the office. And, it's based on BMI, which is your body mass index, which is a formula that uses your height and weight to come up with a number, and we use that to guide who qualifies for surgery. So you have to have a BMI of greater than 35, or greater than 35 if you have documented comorbidities, which are things like hypertension and diabetes, or greater than 40. But I think it would be, if you have a scale, weigh yourself, and you can get online, there's all kinds of BMI calculators, and figure out whether or not you qualify for surgery.
Perfect. Leona, we wish you well. The number to call for the Michigan Bariatric Institute is 1-877-Y-WAIT. Okay?
Thank you.
Good luck to you.
Okay, bye-bye.
Bye-bye. Janelle, you're on the line with Dr. Roberts and Kelly Brighton.
Hi, how are you?
I'm great. Your question?
I was calling to find out what would be the suggestion for lap band after gastric bypass. I had the bypass done in 2006, and I got pregnant the end of 2006. I had the bypass in March, but I ended up getting pregnant in the end of 2006, delivered in 07, and then got pregnant again. So I gained almost half my weight back that I lost.
Yeah, I think the suggestion would be, number one, you'd have to come in for a consultation for us to take a detailed history, have you see our dietitians and see exactly what you're doing. And then from there, if we see that there's any things that we can help you with as far as what we call, getting you on the right track, and see if maybe we can still get you to lose that weight with the current surgery. That happens a lot more than you think. And the other thing would be to look and see if there's something structurally wrong with the surgery, and that could always be fixed surgically.
But the idea, the hope is that you could actually get her involved in weight management, exercise, and eating right without going back for surgery.
Right.
Okay, because that's what I'm currently actually doing. I go to the Y approximately 4 to 5 times a week, and it does seem like my pouch, from the original surgery, is still fairly working because I still cannot eat large amounts. I know when to stop because my stomach tells me, okay, that's enough, and I stop as soon as I get full. But, so the first step you said would be is to come in and get like some type of evaluation for a dietitian?
Absolutely. We have our dietitians run a monthly seminar. It's called Back on Track, and they could really see you, talk to you about what you're eating, and help you there. And I think that we could get you back on the right path without doing another surgery.
And just because I have the greatest inspiration right next to me, I'm going to let Kelly give you a little inspiring talk right now. Go ahead.
I think absolutely call MBI. That is just one of the greatest things besides doing the surgery there. They have so much support in the office, their monthly meetings, and they are really, really open to having anybody come who's had the surgery. They're all about giving, the education.
So good luck, Janelle. The number to call, 1-877-WHY-WAIT. Good luck to you, okay?
Okay, thank you. Have a good day.
You too. Kendra, you're on the line with Dr. Roberts and Kelly Wrighton.
Hi.
How are you?
I'm fine, thank you. And how are y'all?
Great.
Good. My question is it a certain steps and procedures that you have to go through before bariatrics? And is lap band and bariatrics the same? Are the risks the same?
All right, so let's start with the steps you have to go through beforehand. I think Kelly can talk about that.
First thing is to call the office, MBI, and then you will come in and go to a consultation. It's also really good to go to one of the orientations that they have, and that they just offer once a month, and they'll answer a lot of questions. And then it just kind of depends on the different surgery. But once you're in the office, they make a little binder with your name on it, and it's all of your information in there, and they walk you through step by step. And
how long from the consultation till surgery?
For me, it was about 4 months.
About 4 months.
Yeah.
Okay, and how was it?
Well, take a look.
It worked. The people in the office are great. There's different, blood work. You have to get a scope done. Different things that the office sets up for you to make sure that your surgery is as successful as it can be. And all of that is done through the office. So you call them with any type of questions, and they have all of the answers.
But if you haven't seen the end of the show, stick around and watch it, Kendra, because she's half the woman she used to be.
Wow, because I have tried everything. I even did the Herbalife maybe a couple of months
You sound like she did last June.
I too did everything.
I even joined the gym, and I lost 4 pounds. I gained the 4 pounds back. I'm still going to the gym. I realized that I'm in my 50s now, and they always told me when I was younger, girl, you better lose it now because when you get older, it's going to be more difficult. And
What do you say to that, Doc, to the people who say, I have tried everything, I lose, I gain it back, I lose, I gain it back?
Well, it's bad when you lose it, and you get this new wardrobe when you lose it, and then in the next year, the wardrobe is just sitting there in the closet because you can't get rid of it. You can't get rid of the weight. You don't want to get rid of the wardrobe.
How many times have you heard this story, Doc?
It's very common. I think that she's the type of patient that's ready to do something that's going to help her. She's tried all the diets. and she's found them to be very difficult, like most people. And she's somebody who will be motivated and will do well with the surgery. And afterwards, she's already started to establish the good habits that are important for maintaining the weight loss.
So good luck to you, Kendra. I hope it works.
Thank you. Thank you. Bye-bye.
All right, bye-bye. Charles, you're on the line.
Yeah, I just want to see how much. If you don't have insurance, how much does it cost?
And it is covered by most insurance.
Correct.
I said if you don't have insurance.
Right, I got it.
If you don't have insurance, you have to come in and see us. You know, usually there's a pricing depending on which surgery you have, and I don't have those exact numbers in front of me, but we do about, I'd say probably 2% of our patients are self-pay, and the hospital basically sets the price for that. But if you called the office, they could give you that number. I don't want to just, you know,
throw out something that's not.
throw out. So if you call the office, they will be more than happy to give you the pricing.
Okay.
Okay. Thanks.
Good luck to you.
Bye-bye.
Bye-bye. Athena, you are on the line.
Hi.
Hi, your question now for Dr. Roberts and for Kelly Brighton.
Yes. I have a disease called CRPS, CRPS, and it has been 4 years now. So I'm in a lot of pain 24/7. And to try to control the pain, I have an intrathecal pump implant, which delivers morphine and bupivacaine through my spine 24/7. So I have not been able to exercise because it's in my lower extremities, and I'm about 100 pounds overweight. So I was wondering if this would be an option for me because of what I'm going through.
Well, my first question would be, are you on steroids at all?
No.
No. Have you ever been on steroids?
No.
No. And as far as you know, this isn't autoimmune related?
Yes.
It is, or it's not? It's not.
From what I understand, it is my nervous system is stuck in pain mode.
Okay. Well, just from what you're telling me, I don't think there's any real contraindication to having the surgery. Obviously, you'd have to go through all the preoperative testing that everybody else does, including, you know, complete cardiac workup and blood work and, you know, the endoscopies that are important. And and it would be important for you to understand that I think that surgery will definitely help you lose weight, but your weight loss may lag somebody who's able to exercise, obviously, because exercise is a big part of this. Every calorie you burn, you know, is helpful. So I think Kelly will tell you that how much important exercise is to keeping the weight loss going.
And it's enjoyable now too.
Right.
So,
Right. And this is my big thing. I've been looking for something for years. We just had our first grandbaby. I can work my upper body, but when it comes to my legs, and I don't know if it's because of the weight or if it's because of the disease. You know, the minute I start to try to walk on my own without my crutches or my wheelchair, my legs swell up 5 times their normal size.
Were you overweight long before you were diagnosed with this disease?
No. No, it's been 4 years that I've been stuck on crutches and in a wheelchair. So within those 4 years, I have gained a lot of weight because I sit.
Can you talk about how uncomfortable it is for you not only to sit there, but also just to try to get around, to look in the mirror? Can you tell us what it's
awful? Like? It's absolutely awful. To know that I can't play with my granddaughter, it's bad. Just to know that I'm this big. I've never been this big. I've always been a small person. I'm only 5'1".
How young are you?
47.
What's the oldest that you'll do this surgery?
65 is really our cutoff age. So we have done patients that are older, but it's really on a case-by-case basis, and it depends on all their medical issues that are going on.
You're a young grandma.
So,
if I were you, I would start investigating this seriously and get your life back.
It would worth at least looking into it. And obviously, we can't promise anything. We'd have to talk to all your doctors and go through everything first, but it wouldn't hurt to come in and see what we can do.
Totally worth the phone call.
Yeah.
Wonderful. I'm going to do this. Thank you so much.
Good luck to you.
Thank you.
Bye-bye.
Bye-bye.
Tony, you are on the line with Dr. Roberts and with Kelly Brighton.
Hi, how are you?
Great. How are you doing?
Good. I have a question. I did have the bariatric surgery done. It's probably been about 4 or 5 years ago. And I put on probably about 60 pounds. And is there anything...
How much did you lose initially?
I lost about 180. I started off at 381. I think my lowest goal, the lowest I got was like 210.
And then what happened?
I don't know, stress, a lot of stress. The last 2 years, a lot of stress. And I know I'm eating wrong, and the problem is I can't, I have one knee replacement, I have to get another knee. I'm just so physically, I can't walk. And that used to help me out a lot when I first had the surgery done. But I'm concerned now because I really do now want to get into the 300s and back to where I was.
So, Doc, when you hear a story like this, first of all, honestly, how often does it happen that somebody goes through the struggles of a surgery? Because it's not an easy surgery.
No. Oh, no. I mean, it was hard, but it was the best thing. I would recommend it to anybody.
But how often does it happen that they then sort of take a back step?
Well, I mean, I think that around 4 to 5 years after surgery, you're going to see the ability, what I would say, the ability to gain weight back. Not necessarily that you're going to, but I think that the anatomy becomes a little bit more accommodating, and people are able to eat past that point of fullness. As you know now, if you eat too fast, or if you eat more than you think you should have, the surgery's not very forgiving. No, it lets you know. And as you get further out, it is going to be a little forgiving. So if you're not, if you're falling into bad habits, if you're overeating, the anatomy is going to allow you to do that.
What's the key not to let that happen?
Well, I think it's just like everybody else. It's, we want to reset your metabolism, reset you at a normal weight, and then from that point on, it's your job to maintain that weight and maintain that lifestyle. If you don't, like Tony, you can fall back into bad habits, and life stress happens, and we see that a lot.
But Tony's tasted the good life. She lost 100 pounds.
Yeah. Well,
I lost 180 pounds, man. It was awesome.
Tony, do you have any kind of a support group or people that have been through the surgery that you talk to?
Yeah, I have. There's a couple people, that when we all had them done at the same time, some have gained some weight back, but nothing major, like within 15, 20 pounds.
Yeah.
And I was fine really doing good up till like about 2 years ago, and then the bottom dropped because so much stuff has been going on in my home. And it's like, like anything else, food has always been my comfort zone. I'm Italian, and pasta's like right there. People eat chocolate, I could eat pasta, you know what I mean?
Right.
It's, and I catch myself, and I really try, and it's just like, oh my God, this can't be happening to me again. I'm 57, I don't want to be unhealthy, and and I'm just like, I'm so worried about it. I'm conscious of it, but yet I just can't get anything under control. And I'm just wondering, is there anything out there to get me started? I'm looking. I'm really looking.
Well, I think you're a good candidate to come in and, at least come to one of the meetings for our Back on Track program and see, that our dietitians and staff could do something to help you. It's possible that the pouch was made too big initially and that could be downsized, but usually that's not the case with the gastric bypass. But
Tony, make the call. Get back on track. Okay? 1-877-YWAIT is the number you need to call. Find out when they have the Back on Track meetings and go for it. We wish you luck.
What's the number again? I'm sorry. What is it?
877-YWAIT. W-E-I-G-H-T. 877-YWAIT.
All right. Thank you.
All right. Good luck to you.
Day.
Thanks. Bye-bye.
Bye-bye.
Margaret, you are on the line with Dr. Roberts and Kelly Brighton. How can we help you?
Hi. Yes, I would like to know if a person who has a multitude of problems physically and
you mean like problems with your back, problems with your knee?
Yes, I've had my husband says I've had about 12 surgeries in my life. I've had 3 back surgeries, still in a lot of pain with my back, which has caused me not to be able to walk.
Do you think a lot of this is from the weight, or is the weight because of all the surgery?
I have degenerative disc disease, and I have degenerative bone disease.
Were you always heavy?
I have, yes. Even as a young girl, I was probably heavier than I should have been.
How many pounds overweight are you, Margaret?
I'm 5'8", and I weigh 241. I was wondering if, I'm diabetic. I have,
Well, here's the magic of this surgery. For some of these people who talk about their blood pressure and their diabetes and their cholesterol, what happens after surgery?
Well, it's gone for most people. A lot of our patients that are diabetic are on insulin, and after surgery they're not. The blood pressure medications are reduced. If not, they go away. And knee and back pain is definitely going to be helped if you're carrying less weight. Obviously, we can't bring back bone in your knees and in your back that you've lost, but carrying less weight will definitely decrease your pain.
What did the doctors tell you before surgery, and what are they telling you now?
They are happily surprised when I go in. Just everything. I mean, I was a pretty healthy person beforehand, but just, my energy and just my weight is just remarkable.
And what were the warnings they were giving you, though?
Watch out for diabetes, high blood pressure, all of the, weight-related, issues.
So what are you thinking now, Margaret?
I'm fearful of surgery.
But you should be a pro at it by now.
Yeah. I've been on so many medications that I would like to get off of them. Like I'm hearing that is occurring with having this surgery done.
I would tell you to make the call and have a consultation. Would you agree, Doc?
Absolutely.
1-877-Y-WAIT. Okay, Margaret?
Okay, 1-877-Y-WAIT.
That's right.
Okay, thank you.
Just tuning into this web chat, we have bariatric surgeon, Dr. Jacob Roberts, and the star of Discover Remarkable, now having lost 96 pounds, Kelly Brighton. We're taking your calls and questions at 248-356-0077. Line 3, you are on the air now with Dr. Roberts and Kelly Brighton.
Hello.
Hi, your name?
Jean.
Hi, Jean. What's your question?
I was wondering, I don't know, I'm kind of scared. My sister said that I really need to consider this, since every time I lose weight, I gain back more, and now I'm the biggest that I've ever been in my life.
What's that mean? How overweight are you?
I'm 250 pounds right now.
And how tall are you, Jean?
5'1".
What's it like for you?
I hate it.
What's the hardest part for you?
Not being able to do the things that other people do.
How young are you, Jean?
I just turned 50 on the 27th of January.
And how's your health?
I'm diabetic. My cholesterol, I'm taking a pill for cholesterol. I had 3 surgeries on my knee. 2 on one knee and 1 on the other. I have 4 grandbabies I want to be there for.
Now, what has stopped you from going through with this in the past, or have you thought about surgery in the past?
I'm just afraid. I've heard people dying from it. I'm scared of being, going to having surgery.
Well, I can understand that. Being a mother of 3 and, having a husband and my family and, my nephew and a big family, going into the surgery, I, knew that this was the most selfish thing I was going to do, because I am putting myself at risk. But the one thing that made me so okay with that is having it at St. Mary through the MBI, because of their, stats of their surgeons. And everyone there, I mean, they treat you like family, and they care about you, not as a patient, but as the person. And I think that really, really helps put your mind at ease. And to me, you sound like, if I met you on the street and you told me your story, I would say absolutely give them a call. I think that the positives of this surgery are definitely going to outweigh, the negatives and the stuff you're scared about.
You're worried about something bad happening in surgery, but I got to believe that something bad happening right now. Wouldn't you agree, Doc?
Absolutely. I think that there's no doubt that the risks of staying morbidly obese outweigh the risks of surgery, and that the death rate over 5 years, if you look at patients that have had the surgery and patients that have it, it's going to be higher in those who haven't.
So, Jean, the number means something. 877-Y-WAIT. WEIGHT, okay?
Okay.
Good luck to you.
Good luck.
Thank you.
You're on the line with Dr. Roberts and Kelly Brighton. Who am I talking to?
This is Cynthia Amaker.
Hi, Cynthia. What's your question?
Well, I have been seriously considering the surgery, but I was just wondering what are some of the criteria that you have to meet to be considered a candidate?
Good question. First of all, how overweight do you need to be?
Well, we say 100 pounds overweight, but really that's not always true
because if somebody's 5 foot tall,
exactly, yeah. So it's really based on your BMI, like I said before. So it's your height and weight, and there's a formula that calculates your body mass index, and you have to have a BMI of greater than 35 with documented comorbidities such as high blood pressure, diabetes, sleep apnea, heartburn, or greater than 40.
Cynthia, how overweight are you?
Oh, I'm over the 100 pounds. I am 5'6", and I'm 335.
And how long have you been this overweight?
It has gradually gone up, but I've always been pretty heavy, even through my early 20s, and I'm 41.
Kelly understands that one.
Her life as an adult.
So, what's it like for you even just climbing a flight of stairs?
One flight, not bad. 2 or 3, it starts to get a little tasking. And now I have started to experience pain in my knees.
And I take it you've probably tried every diet out there?
Oh, yeah, I have. And I mean, I've gotten to the point, well, about maybe 40 pounds successfully. Then it's like I plateau and it never goes anywhere else.
And Cynthia, when you watch,
then I become frustrated.
When you watch this special, Discover Remarkable from the St. Joseph Mercy Health System, when you watch this show and you see Kelly's transformation, what do you think?
I'm just overwhelmed with it because I have a 17-year-old and a 4-year-old, and I just feel so bad because I'm at a position right now where my 4-year-old doesn't get to enjoy me like my 17-year-old did when I was a lot smaller.
Right.
And I feel, bad for him, but I am willing to do whatever it is. I get discouraged with the diet because, like I said, I will lose some weight and I get all excited, and then, 2-3 weeks later, I'm still at that same weight, and it just never seems to go anywhere. And
well,
then I become
Cynthia, here comes Kelly's pep talk.
Do it! Give him a call. It is amazing. When I look back to a year ago with my kids, because I have a 3, a 5, and a 6-year-old now, the stuff I get to do with them, they're like, oh, Mama, you want to do that? Oh, you can do that? It's just, my life is better, and their life now is better because of it. And I would tell you, please call. It is just, do it for your kids.
One of my favorite lines in the show came from Teresa, who said, my daughter says now she can hug all of me.
All of me,
which is so special,
Yeah. Your kids, they love you unconditionally, but in the back of your mind that there's something that they're missing from their parent because you can't give them everything that you would like to.
Well said, Cynthia. Make the call, 1-877-WHY-WAIT. Good luck to you.
All right,
Thanks so much. Bye-bye.
Bye.
Marlene, you're on the line with Dr. Roberts and Kelly Brighton.
Okay, thank you.
How can we help you?
Yes. What is the age limit for the lap band?
Well, first let me get to your statistics. How young are you?
74.
How overweight are you?
I'm 220.
And how tall are you?
5'1" and a 4.
And how long have you been overweight?
I lose 50, 60 pounds, gain it, the usual.
So what do you say to people in their 70s? Because nowadays people live to 100, so...
Yeah, I mean, right now we're, our age is 65. However, on a case-by-case basis, we are doing patients that are older, but we really have to look at all their medical illnesses just because the risks of the surgery, the risks of the anesthesia, and post-operatively becomes harder and harder with
you can't guarantee they're going to be able to do the exercise and all things they need to do at 74.
But
I didn't do it before because when I tried it I asked it with 66. I never knew about it until 66.
Right.
They said I was too old, so.
Yeah.
But now you have the lap band, I thought it'd be different.
Still surgery.
Yeah, it's still surgery, but I think it'd be worth calling and talking to the people in the office and letting them kind of figure out what your medical illnesses are to see if they think it's somebody that we'd be willing to consider if you are.
All right?
Okay?
Okay, thank you, guys.
Good luck to you, Molly. Bye-bye.
Thanks, Molly.
Leela, is that you?
Yes, it is.
You are on the air. Your question for Dr. Roberts and for Kelly Brighton.
Thank you. Thank you for taking my call.
Sure.
My concern about losing weight along with health issues is that there might be a lot of skin that is just there.
There it is. You're talking to the right person over here. Talk about that.
It is true. I am 33 years old, and going into the surgery, I was hoping, that my skin still had some elasticity in it, and it does in places. But I already, 8 months out, I'm dealing with, extra skin in certain areas, and I am hoping to meet with a plastic surgeon to kind of see what we can do with that.
Okay, and that was my other concern, how it is handled, and you're saying it's done through the plastic surgeon, and I wasn't sure my insurance would cover that. So all of that I need to know.
Well, that's a good question. The body contouring that is so often done afterwards, that they offer at St. Joseph Mercy, is that covered by insurance?
I'm sorry, I really couldn't hear you.
Well, the abdominal skin, what you call a tummy tuck, is usually covered by your insurance. But however, you need to have the same insurance you had when you had the surgery. That can be an issue with pre-existing conditions if you switch insurances. But usually we can get it covered. We just have to document that you've lost a certain amount of weight and that the excess skin is causing you issues as far as back pain or rashes and these sort of things. We can get it covered. There's other parts that people want to have tightened up as well, as far as the arms and the thighs, and that's usually not covered. But I think the biggest issue is usually the abdominal skin. That's what makes the clothes difficult to wear.
Definitely.
So you don't know, do you pull your pants up over or under? So,
and there are incisions involved, but the doctor does a really good job of trying to hide those incisions so that they're under your arms or wherever.
Absolutely.
Okay.
All right?
It's about the team working together at the beginning, in the middle, and at the end.
That's exactly right. That's a great team. All right, good luck to you.
Thank you.
Bye-bye.
Bye-bye.
Hi, you are on the air with Dr. Roberts and Kelly Brighton. How can we help?
I would like to know about the surgery, the different types of the 3 surgeries.
So there's 3 surgeries that are offered through the Michigan Bariatric Institute.
Absolutely. And we offer the lap band, which is probably the one you've heard about the most, and that's where we place the silicone band around the upper part of the stomach. And this allows us to inject it with saline to control the tightness around your esophagus and to decrease your hunger and decrease the amount of food that you consume. There's the gastric bypass, which is a small stomach pouch that's created from your existing stomach, and a portion of your intestine is bypassed. And there's the sleeve gastrectomy, which Kelly had, which is a fairly restrictive procedure where we remove about 80 to 85% of your stomach, and there's no malabsorption, and there's no involvement in the intestine. It's purely on the stomach, and there's no need for further adjustments like the lap band does. So the weight loss is a little better with the sleeve compared to the lap band, and the gastric bypass and the sleeve are pretty comparable in weight loss at this point.
So I watched Kelly's surgery. I was there right there in the operating room and saw the sleeve, and I can tell you the most remarkable thing is that it was 45 minutes. I mean, it was unbelievable how quickly they were able to remove 85% of your stomach.
Absolutely. Somebody like Kelly who hasn't had a lot of previous surgeries, doesn't have a lot of medical issues, it's really a pretty fast surgery when you think about it.
And then to see how it's changed her life is unbelievable. I hope that answered your question.
So, if you've had other surgeries, it's not as good?
No. Other surgeries can make the surgery harder to do because of scar tissue you have on the inside of your abdomen from those surgeries. If you've had previous gallbladder removal, bowel resections, and these sort of things.
Doesn't mean they can't do it. It just means it might not be as easy.
Correct.
Okay, because I've had gallbladder and appendix.
That's very common and usually not an issue.
Alrighty?
And where do I get more information?
1-877-Y-WAIT. Alright? I hope that helps you, or you can always go, there's a couple of websites you can go to. You can watch more of Kelly at stjoeskellycam.org, or stjoeshealth.org/Michigan Bariatric Institute. Good luck to you.
Thank you.
Bye-bye. Hi, you are on the air with Dr. Roberts and Kelly Brighton.
Hi, Dr. Roberts. How are you today?
Good. How are you?
Good. Hey, Dr. Roberts, I had surgery, gastric bypass, over 10 years ago. Lost over 230 pounds.
Wow, good for you.
Over the last year and a half, I've put back on about 75, 80 pounds. The surgeon that originally did my surgery is no longer in the Michigan area here. I have attempted to, find a site that you can help me. I feel like my stomach's just been stretched back out again. I've had gastric problems. I've been down to the university to help, and I just haven't had anybody that helps me to understand what I'm going through again. Put this weight back on again. I know I can lose it. I'm just wondering if there's any way that you guys can help me.
Well, has anyone done any type of studies to examine the upper anatomy of the stomach and the pouch?
Well, I did have that done, and, it seemed like after that was done, all of a sudden the weight started coming back on again. I personally feel like the first, gastrologist that did it did some damage to me, because ever since I've done that, I've had dumping syndrome, I've had all kinds of issues and problems, and I just can't seem to get through to anybody. And seeing you guys here today, I'm hoping maybe I can somehow get in to see somebody that's been through this and can help me.
Yeah, I think you should come into the office. Obviously, we'd want to get some studies to take a look at your surgery. I would assume that you had an open gastric bypass.
Yes, I did.
Yeah, it was 10 years ago. So we'd want to take a look at the size of the pouch. We'd want to take a look at the opening between the pouch and the stomach. There are some less invasive endoscopic procedures out there that can be done to close that opening down, and that has some good results, though we don't really have long-term data on that, how well that's going to work, but there are such things as the stoma fix procedures, and if the pouch is just really dilated or if it was made too big to begin with, there's always a possibility of a revisional surgery.
All right. Good luck to you.
I think I'm a great candidate, so it's just a matter of getting in to see you guys.
Okay,
right.
Give us a call.
Good luck.
Thanks.
Thanks for calling.
You bet.
If you're just tuning in, I'm Lyle Lazarus. I'm here with bariatric surgeon Dr. Jacob Roberts from the Michigan Bariatric Institute, where they have surgery centers at St. Mary Mercy, Livonia, St. Joseph Mercy, Oakland, and also St. Joseph Mercy, Port Huron.
Correct.
And then the superstar of our show, Kelly Brighton, who has lost 96 pounds since June, at a time when she didn't think surgery was going to work because nothing else had worked. The show is now aired. People have seen it. What's been the response for you?
Nothing but positive. It's overwhelming. I mean, the response from people day-to-day life who've seen it, but then family members of other people, coworkers, they'll come up and say, can my sister Facebook friend you, or can so-and-so call you because they have some questions? And I expected some negative, and there's nothing. It's very overwhelming.
And tell me what the students at school have said, because she's a teacher.
Well, and my students who I have now look at and they're like, oh, Miss Bright, no way! You didn't look like that! And then some of my older students who I've had in the past are like, wow, Miss Bright, I didn't recognize you. I was over at the high school the other day, and it's just nothing but positive. It's very cool.
So great. And at the Michigan Bariatric Institute, the response?
Oh, it's been very good. It's been all positive. Lots of phone calls, lots of interest. We're really happy.
That's great. And what's it like for you knowing you're transforming lives like you have with Kelly?
Well, I mean, I think it's fun, really. I think that'd be the best way to describe it. To see, people like
he's
Kelly
transforming lives, and he says it's fun.
It is. They come in, they're nervous. They're unsure. They're depressed about the way things have gone with their weight. And then 3 months later, they're not nervous anymore, and they're just really happy. And
what I find so remarkable, having watched you every step of the way, is that after a month, you thought you were skinny already. After 2 months, you thought you were skinny already.
I know. I was watching the special again. I remember my first interview with you, and I looked at it, and I thought I was confident, and I looked back, and I was so self-conscious. I knew that was just how I was, and then now, I'll talk to anybody about anything. But I'm like, I wasn't really that thin in that dress that I was so excited about,
But you look fabulous now. Let's get another caller. Hi there, you are on the line with Dr. Roberts and Kelly Brighton. Are you there? Oops. Are you there?
Yes.
Sorry. Operator error. How can we help you?
Yes, I was calling to find out, once you've had the sleeve, does it grow over, does your stomach grow over a period of time?
Good question.
Pardon me?
Good question.
Yeah, that's a common question: is does the gastric bypass, does the pouch stretch? Is the sleeve going to stretch? And the answer is yes, but it's not going to stretch out to anywhere near your stomach sizes. It is going to stretch a little bit, obviously, because early on it is so tight, and over time it is going to stretch out a little bit. But you're always going to have that sense of fullness off of a small meal, and I think that's the idea.
And what I found is it has stretched a little bit, but if you eat, the protein like you're supposed to, you definitely feel full quicker, where if you eat the carbs and some of the sugars and stuff, you definitely don't feel the restriction right
So,
away.
what'd you have this morning, T?
I had a protein shake. I was real good.
And when you say protein shake, how do you do it? What do you
just some milk in the shaker because it was real quick because I was running around. Eggs are great, and then the Greek yogurt I'm a big fan of.
Okay, so another question: if you gain weight, can you lose that weight off, or is it something that just stays there, or what? Can you, if it stretches and if you gain weight, do you lose that weight off?
Have you gained any weight at all?
I'll fluctuate a couple pounds at a time. I'm kind of going through a stall right now, and I can understand because I do get frustrated, but working out and the eating healthy, I know what to do, and I know I'm going to see the results, where before I would do those things and I wouldn't see any results. So
why is that? Why is that before she would do those things and not see results?
Well, I think that a lot of it has to do, I think, with once you reach a certain state, that the metabolism really slows down. Okay, so what we call your basal metabolic rate, the rate that you burn calories just sitting there, is really slow. And it's what we do with surgeries. We try to reset that. So we put you in a state of starvation basically early on, and then you slowly increase your calories, and at the time we're pumping you with protein, keeping your protein up, and that BMR becomes higher and higher, and then when you stop losing weight is when it starts to equal, where the rate that you burn calories and the calories that you consume, they equal, and that's really about 75 to 80% of your excess weight. And we say the other 15 to 20 pounds you got to sweat it out at the gym. So,
right.
Yeah.
Okay.
All right.
Okay. Thank you very much.
Good luck to you.
Bye bye.
Hi there. You are online with Dr. Jacob Roberts and Kelly Brighton. How can we help you?
Hi, I'm actually calling for my son, Kevin Blackwell. He's interested in the bariatric surgery, but he has not straight Medicaid. He has the family medical plan insurance through the state of Michigan.
And you're wondering if it will be covered?
Yes.
I think the first place to start is you have to call the representative for your plan and see if the type of public aid that he has covers bariatric surgery. Okay? And if it does, then you come in and see us, and there's a step that we have to take to get it approved through the state. It is a long process, but if you're patient, we can get you approved for surgery. But it can take up to a year.
Okay.
Okay? But the first step is to call and talk to his rep and find if he does have bariatric coverage or not.
Okay.
What a good mom you are.
Absolutely.
He's sitting right here. He just, he says, Mom set me up.
Hook me up, Mom.
2 years old, but he says, Mom set me up.
How overweight is your son?
Kevin, what's your weight? He's 360.
All right. All right, well, good luck. Make the phone call.
Call Kevin's rep then.
Okay.
All right?
Thank you.
Good luck.
Okay.
Bye-bye.
Thank you.
Hi, you are on the line with Dr. Jacob Roberts and Kelly Brighton.
Yes, I was calling to get some information about the surgery.
Okay. Is it for you?
Yes.
And tell us your name.
Victoria Bradshaw.
Victoria, how old are you?
I'm 52.
And how long have you been overweight, Victoria?
About 25 years.
And how overweight are you?
I'm about 375.
And how tall are you?
5'7".
And what's it feel like for you day in and day out?
It's getting harder.
Tell me why.
It's getting hard. I have seizures, so if I fall or something like that, then and I hurt myself, then I can't walk for a while, and then to to get to, you know, when it heals up and then I can walk again, it's really painful and it takes a long time, and I never seem to get back to the, you know, to the point where, you know, I started at. You know what I mean?
What would you say, doctor?
I think she sounds like somebody who could definitely benefit from a weight loss surgery. I think she should come in and talk to us. We'll go over all of her medical illnesses, and answer all of her questions and figure out what surgery, you know, is really best for her.
What do you think is the biggest myth about bariatric surgery?
That it's the easy way out. I think that's probably the biggest myth.
That's what I've learned from having spent 6 months now watching Kelly and watching the Michigan Bariatric Institute. Because I admit, I'm somebody who loves to exercise, one of those weirdos that loves to do it. And so I always thought, if you're overweight, diet and exercise is what you do. But what we've seen over and over again is there are people who have tried it. It's worked. And then they gain the weight right back. It's worked, and then they gain it back.
And the thing I found now, I like to exercise too. You know,
isn't it great?
Well, and it's enjoyable now. Before it wasn't. I mean, I think when you are past a certain point, being overweight, exercising is just—it's painful.
Right.
It is painful. Yeah, it is painful.
So make the call 1-877-Y-WAIT. All right, Victoria.
Okay.
Good luck.
We wish you luck with it.
Okay, and that's where I call to
get a consultation.
Okay.
They'll answer all your questions.
You can find out about our next seminar. You can, you can start there. It's a free seminar. It's an hour and a half of education.
How long have you been thinking about this, Victoria?
A little more than a year.
How long did you think about it?
I would see little clips on TV or read little things, and I'd say, but, then I would say, oh, that's the easy way out, that's just a cop out, that's just and then I, would put it off again,
Well, it is a big decision, but it's definitely worth the call.
And it's not the easy way out.
No, it's not.
You really have to make a real commitment. So good luck with that, Victoria.
Okay, thank you very much.
Good luck. Bye-bye.
Okay, so I call this
1-877-Y-WAIT. Yep.
Okay, thank you
the
very
Michigan
much.
Bariatric Institute. Good luck. Bye-bye.
Okay, bye-bye.
Hi, you're on the line with Dr. Jacob Roberts, Kelly Brighton, and Lila Lazarus. How can we help you?
Yes, I'm calling about that TV program you had on about bariatric surgery.
Yep.
I'm interested.
Okay, so tell us about yourself. First of all, what's your name?
Denise Jacket.
Hi, Denise, and how overweight are you, Denise?
I weigh 317 pounds, and I'm a type 2 diabetic. I'm insulin dependent.
How tall are you?
5'6".
And how long have you been overweight?
Quite a while. I had the surgery done, the gastric surgery done back in '81, and I got down to a size 12, and then I gained it all back again.
Wow, 1981, she was a pioneer.
Yeah, I'm not sure what procedure you had. Do you know? Did you have the VBG?
The gastric surgery where they open up your stomach, tie the pouch or something, staple.
Yeah,
stomach stapling.
I think is what she had is what we call the vertical banded gastroplasty, and it was.
Yeah, that's it.
Yeah, and that was a good procedure with excellent weight loss. The problem is over time is the staple line where they divided the stomach. It opens up. It opens up, and you end up with your whole stomach back. And so
that's what happened.
And so,
how nice was it when you were actually losing the weight?
Huh?
How nice was it when you actually lost the weight?
It was great. It was really nice. I mean, I've got a lot of problems, a lot of medical asthma, everything, but I felt so much better when I lost the weight.
Yeah, and our practice, I don't know exactly the numbers, but we've done revisions on VBGs and converted them to a gastric bypass with excellent results. So.
What do you think about that?
I need to do something, because I'm at the point I can't walk, and I'm having a really hard time.
What's it like for you when you're out in public?
Embarrassing.
you know, I have a hard time walking. I have to use a scooter in the stores and stuff, and, you know, use a cane, walk with a cane, and, you know, I did have my knee operated on too, a knee replacement, and I'm having a really hard time with that, and I think it all has to boil down with my weight.
Well, you're somebody who understands how wonderful it can feel, the success of the operation. So I would suggest you give a call, 877-WHY-WAIT. Good luck to you.
Okay, thank you.
Bye-bye. Hi, you are on the line with Dr. Jacob Roberts and Kelly Brighton. Are you there?
Yes.
Hi, how can we help?
Oh, yeah, I just watched about the bariatric.
Yeah, what'd you think of that?
I thought that was really nice. And you're Kelly?
Yes, I am.
Oh, congratulations.
Thank you so much.
That was great.
Thank you.
You know what, my question is, how old is too old to get on something like that?
Good question.
65 is the age that we've set. However, we have done patients that are older, and it's on a case-by-case basis, where we have to bring you in and look at all your medical issues and see if whether or not we think we can do the surgery safely.
Okay.
How young are you?
I'll be 72 March 5th, and I do have diabetes. I'm on insulin. I take blood pressure and cholesterol. I weigh 130. This morning I weighed 236.6. That's what I weighed this morning, and that's up about 4 pounds from before Christmas.
Well, they usually have an age limit of 65, but you can always make the call.
Absolutely.
877-WHY-WAIT and change your life. What do you think?
I can do what?
877-949-9344.
Okay.
All right?
And so I have to call them
and they'll be able to answer all your questions.
Okay.
All right?
Thank you.
Good luck to you.
It wasn't
Thanks for calling.
Thank you very much.
Bye.
So again, if you want more information, you can always go to St. Joe's Kelly Cam and watch what it was really like. stjoeskellycam.org. Is it stjoeskellycam.org? Just to see what it was really like for Kelly throughout this procedure. There were some days you were not a happy
They were
camper.
not all good days. They were not. But it was all worth it. Definitely.
Especially at the beginning,
Yeah,
right?
yes, definitely.
It's surgery, and it was tough.
And you forget about that. It's like having a baby. It's been great, but it is rough in the beginning. It is.
The other website you can go to is stjoeshealth.org/MBI. stjoeshealth.org/MBI. Or, of course, the number to call, 1-877-WHY-WAIT. And, Doc, before we go, if you could just give your closing arguments about why this surgery is so transforming.
Well, I think that it's a group of people that are in need of help for a multitude of reasons. Social is probably the least important, but to the patient, probably the most important.
Biggest impact, yeah.
But to us, it's the medical illnesses that lead to debility, that lead to more days spent in the hospital, more visits to the doctor, more healthcare dollars spent. So I think that we can get you on a path for a healthier and longer life.
Beautiful. Kelly?
I am thankful every day that I chose to do this. It's not the easiest thing, but everybody says it's a tool, and it is. It helps me, keep losing the weight and be so much healthier and happier.
The show is called Discover Remarkable at the Heart of Medicine through the St. Joseph Mercy Health System, the Michigan Bariatric Institute. We hope you've enjoyed it. 3 lives completely transformed, and as we heard at the beginning of the show, a new life is going to be transformed. Your husband is going through it.
Yes.
We wish him well.
I will tell him.
The telephone number says it all, 1-877-WHY-WAIT. Good luck.